Good evening, everyone. I am Dr. Rajesh Buddhadev from New Skin World Institute, Surat. I am the Chief Dermatologist over here, and I was a National Vice President of IDVL in 2015, and presently I am holding the post of National Chairperson of ITAC Committee. Now, today we are discussing about the atopic dermatitis, recent updates about its pathophysiology as well as its burden of disease and its mainstay of treatment. Atopic dermatitis is a common inflammatory skin disorder characterized by recurrent eczematous and lichenified lesions with intense itch. The persistent pruritus or itchiness is the main symptom of atopic dermatitis. The disease typically has an intermittent courses of flares and remissions occurring, often for unexplained reasons, during the course of the disease in patient's life. The disorder affects people of all ages and all ethnic group and has substantial psychosocial impact on patients and relatives, and one of the leading cause of the global burden from skin disorder is atopic dermatitis. Atopic dermatitis is associated with increased risk of multiple comorbidities including food allergy, asthma, allergic rhinitis, and mental health disorders also. Atopic dermatitis is not a life-threatening disease, but it brings severe disruptions of the quality of life to the older patient, especially in the age group of 70 plus and more than that. Now, regarding the pathophysiology of atopic dermatitis, the pathophysiology is complex. It involves strong genetic predisposition, epidermal dysfunction, and T-cell driven inflammation. Type 2 mechanisms are dominant, and there is increasing evidence of the disorder which involves multiple immune pathways. Now, what are the mainstay of treatment? The recent treatment options are available, and it has been said that epidemic of atopic dermatitis is going on at present in the COVID era also practically. The direct patient education in case of adult atopic dermatitis and to the caretakers of infant and childhood atopic dermatitis is required. Change in bathing practice in atopic dermatitis patient is also required, and whenever necessary we have to counsel them for the proper bathing advices. Elimination of exacerbating factors is another important aspect. To manage stress and anxiety in the patient is one of the most important aspects when the adult atopic dermatitis cases are seen. Dietary intervention in selected cases, maintaining of skin hydration with topical therapy, controlling pruritus with pharmacological agents and non-pharmacological intervention is one of the important treatment mainstay, or one of the important thing what we require to include in our treatment plan. Use of pharmacological modalities to control the inflammation of the skin is another important thing. Use of systemic immunomodulator drugs and biological agents in severe and recalcitrant diseases with extra precautions in COVID-19 pandemic is one of the things we must look for during the present pandemic, which is the ongoing pandemic. Still there is no end seen in the pandemic, so we must do something about the recalcitrant case of atopic dermatitis with the precautions of immunomodulatory agents, or the main important thing about the treatment with the severe comorbidities is required. Currently there is no cure, but increasing number of innovative and targeted therapies hold promises for achieving good control, including presence of recalcitrant diseases. This was to summarize the discuss advances of our understanding about the disease and implication for prevention, management, and future research. Well, thank you very much.